Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith Rogers. Today, the flu. We find ourselves in the middle of a highly contagious flu season, and today Andy Pekosz, a Johns Hopkins virologist, returns to the podcast to talk to Stephanie Desmon about the rapid increase in influenza, why new mutations are leading to the worst season in decades, and how there's still time to protect yourself. Let's listen. Andy Pekosz, thanks so much for joining me.
Oh, always a pleasure to be here.
So let's talk flu. We've done this before, but it's a new season. And what are we seeing out there?
Yeah, and there's a running joke in the flu community that every season is a new flu season because it seems like there's always a little bit of uniqueness to every flu season. This year, we're seeing flu around the U.S. in particular, around the time we expect to see it. We always see upticks around Thanksgiving. They start to increase significantly in the winter holidays. But what's novel about this year's flu is how quickly it is spreading once it gets to an area. So I look at some of these flu maps and I see states that are basically have no flu activity 1 week, 2 weeks later, they're in epidemic stages. And all of this is driven by one particular virus called the clade K H3N2 virus. So it's causing a lot of cases, and it's the rapid increase in cases that is making this flu season particularly unique and, of course, challenging because that's what stresses our medical infrastructure, right? Large numbers of people coming in at the same time.
I've seen that emergency rooms, 10% of the people coming to emergency rooms are coming with flu-like symptoms.
Absolutely. That's similar to schools are places where you've got to really be careful because people are coming in who are sick and there's others who are vulnerable, and spreading in those kind of situations is something that the emergency room staff really has to spend a lot of time on.
So what is it about this clade that is making the flu spread so quickly?
Yeah. So when we look at the sequence of this virus, right, on paper, we, right from the beginning, can tell that it has mutations in two hotspots that we know are important for that people generate antibody responses to. They generate their protective immune responses to those two hotspots. This clade K virus seems to have mutations in both of those hotspots. So right from the get-go, we imagine that people who are either vaccinated or even have been infected recently with H3N2 are probably going to have an immune response that isn't recognizing this clade K virus very effectively. And so what that means is more people are susceptible because even though you have an immune response to flu, it's not recognizing this clade K variant very efficiently. And I think that's at least one factor that's clearly driving how quickly this virus spreads in the population. There's just not as many protected individuals as we normally see, and protection can be gotten through vaccination or infection, ideally through vaccination, but that protection is really not there this year because it's not recognizing clade K.
So is it more serious or more contagious?
Yeah, so far, it seems like it's just more contagious. If you see the rates of, let's say, emergency department visits or hospitalizations, they seem to be rising at around the same proportion as the total cases. So certainly there are more hospitalizations this year, but as a percent of the total cases, it doesn't seem to be particularly high. So it's probably just a case of this virus infecting more people, and then we have that corresponding rise in severe cases because of the large number of total cases that's happening.
So let's talk about the vaccine. First of all, is it too late to get one?
Not too late to get one. We're closer to the beginning than the end of the flu season, as we're talking here today, too. And flu seasons normally last about 4 to 6 weeks and takes about 2 weeks for the vaccine to kick in. So there's still time to get the vaccine to protect yourself from the tail end of the flu season.
Well, and you were talking about how the flu vaccine is not a great match for this version of the virus, but it's still better to have it than not in this case?
Yeah. So there's two things here. First, The flu vaccine actually has three components. It has an H3N2 component, an H1N1, and a flu B. The clade K is an H3, and we know that's not a perfect match to the vaccine. But in prior years, when we've seen this type of mismatch, there's still a signal of protection from severe disease, even though there's probably a weakening of the protection from infection that you see. So particularly if you're in a high-risk group for developing severe disease, right? The over 65, immunocompromised people, people with cardiovascular issues, really important to get the vaccine because it will provide another layer of protection for you. But the second thing that's important is, this H1N1 and influenza B virus. The vaccine is actually a pretty good match to those viruses that are circulating. Now, there's not a lot of flu that's being caused by those two strains. But what we usually see in a flu season is towards the tail end of the flu season, you have a switch to some other influenza strains that are causing disease. So again, it's hard to predict, but certainly it would not be unreasonable to think that at the tail end of this flu season, we might see an uptick in H1 cases or influenza B cases, and the vaccine would certainly protect people from that infection.
Why are we sort of in this pickle? Did the strain emerge too late for the vaccine? Could you explain that a little?
Yeah, absolutely. This gets back to the fact that most of our flu vaccine is made by growing virus in embryonated hen's eggs. What does that mean? It basically means that you have to pick the vaccine strain about 6 months before you want to distribute it to the population. So this year, as an example, our vaccine strain for the Northern Hemisphere was picked in February. This clade K virus emerged probably sometime in June. So when we chose the vaccine, when companies were making bucket loads of vaccine during the summer, the virus changed. And it's always the problem that we see with flu vaccines. We lock the virus in at a certain time, but then the virus keeps circulating. It goes to the southern hemisphere and causes cases there during the winter. It continues to mutate, and then it comes back, and oftentimes it's changed. Again, this year we've seen a particularly large number of changes in that virus, but it's a common problem that we have. And until we address how we make the flu vaccines, it's going to be something we have to deal with.
I'm always surprised that the flu vaccine in 2026 continues to be made out of eggs.
Yeah, the issue really is the infrastructure that's in place. Huge investments have been made to streamline this process. 6 months may seem like a long time, but the amount of automation in the process is mind-boggling, right? And so they do an awful lot in that 6-month period of time. But we have to change the platform in order to shorten that time of choices for the vaccine strain. And that's just a hard hurdle to overcome.
Are we being impacted by a lack of data? I know that there's been concerns that the CDC has not been giving out as much data. Are they doing well in this particular situation?
Yeah, the CDC seems to be doing well for most of the things that they're reporting back on. They're collecting data from state public health. They're doing some of their own analysis as well. And most of that has been going fairly well. I will say that I've started to look a lot more carefully at a couple of state departments of health, just as a way to supplement some of the national data. And it is important to note that flu is very much a state-specific kind of infection. Your state may not have a lot of flu right now, so it's important to keep track of what's going on in your particular state. And so I think the most of the data that we're seeing about the strains that are circulating, how many cases there are, have been pretty solid, both at a state level and at a national level.
Do we have any indication if people have been getting vaccinated for the flu this year or if the rates are lower?
Yeah, rates have been dropping for the past about 4 years, I think. Not huge drops, but certainly a noticeable trend, particularly in younger age groups. I think those over the age of 65 are still pretty good at getting their flu vaccines. They're really good at getting their COVID vaccines. They understand the importance of those vaccines. But I think we're seeing a slight atrophy in other age groups. And again, the flu vaccine is not the perfect vaccine, but we have plenty of data to show that it works. We're just not seeing a lot of, number one, pushing of the vaccine, emphasizing the vaccines available. And I think we're then seeing that slow attrition of people just utilizing the vaccine.
And I imagine that government loosening the recommendation on flu vaccines for children is going to make a difference in that case as well.
Yeah, no, absolutely. And again, if you think about the science, if you think about the evidence, we know the flu vaccine protects people. We know it reduces disease severity. We know it even reduces the number of cases. We also know that it works in pediatric populations. And to move away from a recommendation, and again, it was never a mandate, right? No one ever had to get the flu vaccine. But I think there's a big difference between saying it's recommended versus saying, I don't know, go talk to your healthcare provider about it, right? I think that initial approach to people immediately will result in people who end up not getting the vaccine. And again, that's what's so not grounded in science or in evidence.
I've read that this is like the highest number of flu cases in nearly 30 years. What does that mean?
Yeah, so partially this has to do with the fact of how quickly this virus is causing infections. We've now spiked at a level that's higher than we've ever really seen in a particular month nationally. And remember, flu isn't in every state yet. So there still are states that are still going to get the flu that are continue to drive those numbers forward. Again, what we're really looking for is how quickly those numbers will drop. In a best case scenario, these steep increases in cases will result in a equally steep decrease in cases once the virus has sort of infected the people that it can. But that's something that we're right in the middle of and can't really see those signs yet. We are looking at states like New York, for instance, who were unfortunate to start seeing their Clade K flu surge before Thanksgiving. And there are signs that the virus is starting to cause fewer cases and case numbers are dropping. But again, it's one of those in the middle of everything kind of things. And so we just have to keep our eye on the numbers and try to respond accordingly.
Could it turn out to be that we have a very early bad flu season and then it's really mild from here on out?
Absolutely. Absolutely. It could be that all these cases are just concentrated in a shorter period of time because the virus is moving quickly through the population. I'd love for that scenario to play out. But again, every flu season seems to be a little bit unique. And so we're just going to have to try to keep an eye on things and try to, provide information to the public as effectively as possible.
And I imagine that there's a real burden in emergency rooms and doctors' offices right now.
Yeah, absolutely. And, there's a large number of pediatric cases that are coming through. I was looking at some of the numbers from the state, and while hospitalizations are being driven by the over 65, there's a really strong burden of influenza cases in individuals 25 and younger. So it also, we're talking at a time when kids have just started to go back to school after the winter breaks. And again, that's not a good sign in terms of spread in that population because schools are unfortunately one of those places where these kind of respiratory viruses tend to really build up momentum and spread rather easily.
Yeah, I was thinking when you were talking about certain states might not have it yet. Well, after winter break and people go out traveling, they probably will have it soon enough.
Yeah, absolutely. I think there's no such state that should think that they'll be able to be spared from this year's flu season. It's just a question of when it's starting. And then, like I said, we don't know how long the flu season will be, but it will eventually be everywhere.
Talk to me real quickly about the antivirals that people are getting for the flu. Are they working?
Yeah, if there's a bright side to this Clade K virus, it still seems to be susceptible to the two antivirals that people can get here in the US. And those antivirals in the past have been shown to be effective in terms of reducing disease severity and also in some cases even reducing the time of symptoms. But the critical thing is making sure you take the antivirals within the first 48 hours or so of symptom onset. And that can be a little challenging because all of us sort of maybe wake up in the morning with a little bit of a sore throat or maybe a cough or maybe feel a little bit under the weather and we don't think much about it, right? But that could be that first sign of you getting infected. And so one of the things I try to tell people is this is a great time to be proactive. Call up your pharmacy and figure out how you could get flu antivirals if you were to get sick. Most pharmacies have these online areas you can call in. If you can verify that you have a flu infection, they can get you a prescription relatively quickly. But particularly if you're in those high-risk groups, right? A little preparation, know how to get those antivirals because they can really help shorten the disease course and the disease severity if you take them in a timely manner.
Thank you so much, Andy Pekosz, as always.
My pleasure.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.